My name is Gloria Williams, and I'll be making a presentation on the national opioid crisis, which is a requirement for NU 469. I have several objectives today, and they are 65%, at least 65% of my audience, which is composed mostly of nurses and some lay people. But 65% of my audience will be able to describe the national crisis, opioid crisis. 65% of my target audience will be able to tell me some signs and symptoms of opioid abuse. 65% of my audience will know ways to help reduce the national crisis, and 65% of them will be able to know how to make a difference in the reduction of that crisis. There are several opioid facts, crisis facts, that I think you all need to know. And if I talk too fast, I have given everybody a printed copy of it, and at the end of this section, we'll have a question and answer session, and y'all jot down any questions that y'all may have, and we'll answer them at the end of this session. Okay, first of all, opioids are derived from the opium poppy. It can be synthetic or it can be natural. Some examples of opioids are Toradol, morphine, and heroin, oxycodone, hydrocodone. There's several. And this epidemic, pandemic, crisis, whatever we're choosing to call it, doesn't just affect the rich. It doesn't just affect the poor. It affects everybody. It hits everywhere. In the country, in the air, it hits black, white, young, old, rich, poor. It doesn't matter of your health or your socio-economic status. It hit everybody. People injecting with opioids are usually the ones that end up overdosed. Injection usually leads to overdose. Also, according to the Center for Disease Control, approximately 130 people die daily from opioid overdose. And from 1999 to 2018, 450,000 people died from opioid overdose. Opioid leaves you a feeling of euphoria. You have an exaggerated happiness, and it's just because of how it affects the brain. And there are more, you would think that the city area, the urban areas, are more likely to have overdose, where there's people with plenty of jobs, but that's not the case. It's the rural areas with no jobs that are more intense with the opioid addiction. The fastest growing victims of opioid overdose are babies, are newborns. We have at least 25 newborns, babies, every day with opioid withdrawal. Opioid has quadrupled death, and it has quadrupled usage in the 18 to 25 years of age. And from 1999 to 2017, according to CDC, several young people died. Like I say, the death rate quadrupled. Economic, it is an economic burden on all levels, federal, state, and local. It is a burden on healthcare. It's a burden on our resources. It's a burden on our finances. It impacts the finances. The rate and cost of illnesses have tripled, quadrupled, and it's steadily increasing. It has increased Medicare and Medicaid. They're at a level of about 14% of the financial burden. It increased from $504 billion in 2015 to $631 billion in 2018. It has increased the need for nursing staffing. It has increased the needs for more programs needed to combat more drug addiction programs. It has increased the need and strain the emergency medical system, our 911 system. It has increased a much needed education program and drug abuse program and public health, justice, and welfare programs. It has increased the need for a comprehensive health program. It has increased the needs for, like I say, EMS and EMS training. In 2017, President Trump declared the United States national opioid crisis a public health emergency crisis. Over 100,000 patients are treated daily in the ER for the misuse of prescription drugs and opioids. We must learn one way to combat or to decrease the use of opioids is by teaching our lay people, our non-specialized people, the signs and symptoms to look for in misuse or abuse of opioids. They are things like low energy, feeling tired, not being able to stay awake. It can be 150 degrees outside and they'll still have long pants on and long sleeve shirts, and that's to hide the needle track marks. They'll have a change in appearance where they won't take a bath and they won't change their clothes. They'll have, all of a sudden, they'll have a bigger financial burden where once upon a time they were able to pay their bills and loan you some money. Now it's every day they're needing a quarter, nickel, or dime to help them get over the hump. As a nurse, there are certain signs that we should look for as a nurse or the health profession. We should also look for the mood swings where they're really, really up and excited, very, very happy, talking a mile a minute. We should look for that opioid triad crisis for overdose, where you'll have pinpoint pupils, you'll be unconscious, and you'll have respiratory distress or depression, and that's because opioids control that part of the brain that controls respiratory problem, and it will cause respiratory depression. So you just make sure you have your opioid on hand, make sure you have your Narcan on hold, on hand, so we can do some reversing. And then we just look for that itchy, scratchy sores on their skin, because they scratch a lot and they may scratch the skin off their face, and you'll see that they have sores over their body, and then they'll just be very poor and frail looking. There are several things we can do to combat the opioid threat. My organization no longer gives Demerol in the ER. They do drug referrals. They use the DMP program prior to prescribing, which is the prescription drug monitoring program. And what it does, it lists all the narcotics that you've had. And then as in the community, we have Roxy House. Roxy House is a boarding house for mentally ill, especially on the drug addiction. We have several outreach education drug programs, and we have paramedics with intense training, especially on Narcan. And as a nurse, we can make a difference simply by advocating against the use of opioids, teaching our patients and their families the signs and symptoms of opioids, offering referral specialized programs to the clients, asking questions at triage and at admissions about their addiction, and advocating. Thank y'all for being a part of my presentation. Now we'll have a question and answer session, and thank y'all.